Morning. Glad to have you on the other side on Good Morning Anambra. This is the discussion segment. My name is Ajuluchuku Okabwe. Let's talk about certain rights that you probably don't know exist as a human being, but then they are all, as United Nations declare that human beings have rights of virtually everything or virtually every economy wherever they find themselves. And this morning we shall be talking about the Patient's Bill of Rights, knowing your rights as a patient in Nigeria. And I'm sure a lot of people doesn't know that there is such bills that are in existence in this part of the world. And in the studio this morning, I have Dr. Afam Anyeme, who is the Director, Public Health, Ministry of Health, Anambra State. He will be telling us more about the human rights bill, rights of Nigerian patients when it has to do with seeking medical attention for whatever ailment. Doctor, good morning. Glad to have you this morning.
Brother, good morning to you. Good morning, my dear people from Anambra State. You're all welcomed.
Well, that's to make us understand that as human beings, the Constitution says that we all have rights to live in a particular place, to worship, to associate, and the rest of it all. Now you're taking it further by making Nigerians understand that even when it has to do with safeguarding one's health and seeking proper medical attention, we equally have our rights. Please, can you expatiate more on that before so that our listeners can get to know where and the beginning and then the limit to which rights we Nigerians have when it has to do with securing medical services.
All right, thank you very much. These rights exist, just like the moderator have said. They will have a lot of rights in Nigeria, but when it comes to rights and privileges, lawyers should be able to come into play and then explain to us what these rights are. But this one is specific to patients and clients that seek medical and health attentions in our health facilities. So doctors also come in here. And this calls to mind what we call the Hippocratic Oath. That is a list of expectations from doctors and which you must be made to undergo before you ascribe that DR before your name and before you are even allowed to touch or effect a treatment on a patient or a dying somebody. So these are, the rights are many. It wasn't in existence in Nigeria. We were all relying on the Hippocratic Oath doctors take, which I can summarily say to be, one of them is, I still remember that my patients, the life of my patients shall be my first consideration. It is from there we began to expand these rights. And why did these rights come into play in the first place? It's because several years ago, when people take time to look at what is happening at our health facilities in Nigeria across board, people noticed that there has been a lot of infringement of rights. People deny people of certain services. People are neglect services. People are careless with their work. People are so lackadaisical with what they need to do to patients. And a lot of it is occurring everywhere. And then the people we call Consumer Protection Council ran to Federal Ministry of Health and say, how do we stop this? It's giving us problems. Doctors and healthcare workers are expected to, take optimal care of the people that come to them seeking health services, particularly in emergency situations. And what is offered seemed not to be very acceptable to people at that time. And so that discussion began from there until and continued till around 2018, 6 years ago. Then Patient's Bill of Rights came to be. And this right is a kind of, it's like a list of all that people should know that they deserve to have these rights and have these services at the health facilities. Maybe as we progress, I will read them out. It's summarized into about 12 bullet points that even when you expand it, then we'll be spending more than 2 hours to explain it here. But
we'll have to make it brief so that people can know. But
yes,
no, you're talking about this for patients now to be empowered with such knowledge. Is it going to be making the job effective or smoother for the health practitioners, knowing that this person I'm teaching, I'm going to be treating, knows his or her right? Is that going to make you sit up as a medical practitioner in order to deliver your job? Or is it going to give the patient more right Because some people might definitely get to a point whereby they begin to abuse these things and they begin to tell you that it's my right to certain things, it's my right to certain that. Where does the balance actually come in order to make sure that the idea of getting these patients get the desired, treatment, and then for the doctors to be up and doing in their discharge of duties? Where is there going to be a balance? Because I believe
it is both sides. It is for the benefit of the doctors.
Yeah.
It's also for the benefit of, not only doctors, healthcare workers generally, doctors, pharmacists, nurses, lab scientists, all of us that have been licensed to do one or two things for patients out there. And then for the patients community too, it's for the good of everybody. The overall goal is to improve quality of care
and to reduce mortality rate.
By the way, something led to it in Anambra. We unpackaged this rights about 9 days ago in Anambra State. And before we began the plan to unpackage it, we didn't even know it was in existence. But certain things began to happen in this state. A lot of arrests, a lot of litigations, a lot of doctors are in court. A lot of doctors go to police. Healthcare workers bully doctors. Healthcare workers bully patients. Some of them make a lot of noise at health facilities, seeking for this and seeking for that. Doctors themselves and other healthcare workers, particularly doctors, some of them after about 20 years of practice, they forget the Hippocratic Oath. And never are we made as when I'm saying our, I mean because I'm a medical doctor too. Never has anybody made me to come and recite or take the Hippocratic Oath again. I only took it about over 20 years ago. And the tendency for me to forget it is there. And you just keep practicing and keep practicing. And by the time some of the things we see emanating from health services that is not so favorable to doctors in terms of the economy, it will make a doctor begin to be selfish, begin to find a way of salvaging himself economically. And in the process, he forgets the Hippocratic Oath. So it is for everybody. And then for the patients themselves, the patients community, it's also an awakening call that you should ask for this, ask for this, ask for this. You should look for this, look for this, look for this. Particularly when you need them.
When you're beginning to ask for this, look this, you now make the doctor seem incompetent of delivering the services that you are paying for. Because when a doctor tells you that this is what it should be, and then you begin to question because you have certain rights.
Do you know we have quacks? Go to every state. In fact, one of the things we've been fighting in the Ministry of Health since this present administration came is identification and elimination of quacks. A lot of people put signposts with bulbs inside it, with electricity inside it, make every place shine, and they put the name of a hospital there and raise the signboard so high against the recommendation of the Nigerian Medical Association and the supervising councils we have. And they position themselves as doctors, but they are not. But they are not. So part of this patient's bill of rights is that you even ask the person attending to you, please, can I know your qualifications?
Wow, this is interesting. Please, begin to roll down so that you can get to know.
All right. One of it can be summarized into to about 12 of them, but attempting to explain all of them will take us more than 2 hours. But the first is that the patient or the clients out there have the right to relevant information in a language and manner that the patient understands, including the diagnosis, treatment, and other procedures and possible outcomes. You should be able to explain to them. And when you don't explain, patients should be able to ask. There is they should have right to timely access to detailed and accurate medical records and available services. You do a lab test, nobody wants to give you. Doctor examines you, he finds something, he's not telling you. All he needs to tell you is that you should go into the theater, we have to do this and this, and that this your problem will be solved by doing operation. No. That patient deserves the right to know what the problem is and why it must be operation that will salvage him out of the problem. Patients have the right to transparent billing and full disclosure of any cost, including recommended treatment plan. I tell you, as a person, I didn't know this right was existing. Before joining government, I worked in a mission hospital. We don't give you details of your bills. This is your bill. Particularly those ones that have stayed for long. No, we don't. No, it is itemized though.
Yeah.
It's itemized. There's a method of you've stayed for 5 days. The cost of bed for 1 day is this. The cost of electricity and water and hospital utility is this. This is the way we bill it. Doctor services amount to this. The nurses services that come to you amount to this. The drugs amount to this. One by one, one by one. But we usually don't give it to patients. They don't usually even ask. You may not give, but you should be able to explain. So that they understand you are not cheating them. Before we unveil this right, I, as a medical person, didn't know that they have this right, and that I have it as an obligation to explain to them. I don't. And these are obvious causes of the squabbles I will have there. Yeah. You give some of them, they flex their muscle. After 2 days, they want to box.
Why will I be billed this much?
Why will I be billed this much? Because you haven't explained. Now they have the right to be explained. Some of them are interested in just let me be well. Let me be well. And when he's well, all he remembers is I have only stayed here for 3 days, and you brought me out of coma, so for 3 days now. Yeah, it should be 30,000 naira, 10,000 per day. When what you have used may be up to 150,000 in 3 days. But the right requests that you sit the patient down and explain to them. So they may have been oxygen. So they may have received very costly treatments. Take time and explain to them. Even though they recovered after only about 3 days, or even 1 day in some cases. In some extreme cases, emergencies that can take life, the patient recovers in 1 day. And then you bill the person, you say, 1 day? 1 day? Why 1 day? No, sit him down and explain. Tell him the things that has happened while he was on coma. These are the rights. They should have right to privacy and confidentiality of medical records.
We all know that.
We all know that. They should have right to clean and safe, secure healthcare environment. They should have right to be treated with respect, regardless of gender, race, religion, ethnicity, allegation of crime and disability, and economic uncertainties. You should be able to give them this right. Before, it used to be that when we receive bullet injuries, we were forbidden to treat bullet injuries before. But now it's been modified. No.
Even you need police extract.
Yes. No, you treat first.
No, I mean before.
Before, yeah, you need a police extract. You need a program from police. They will have to say, okay, treat. We know this person. He hasn't stolen. He hasn't been carrying guns illegally. Treat. But what was it costing us before?
Untimely death.
People will be bleeding and be dying, and we are looking for police extract. So it's been modified now that treat first and then get police into that matter. Bullet injury is a serious business. That is their right now. Before, we weren't treating them. And if you know you won't go to court, once you see it's a bullet injury, we draw our hands and they carry the patient away. No, now you treat. And then maybe while treatment is going on and you arrange for police to come. Then they have right to relevant information in a language and manner. They will have said it before. They should have rights to receive urgent, immediate, and sufficient intervention in a case of an emergency.
Without any commitment of money.
Exactly. That's their right. You know this right, I can be a doctor now. God forbid, in the next 10 minutes when I leave this place, I can turn to a patient.
Yeah.
A vehicle will knock me down on my way to the office. A vehicle will knock me down. And there's no money with me. And the first clinician to start treating me begins asking of money first. It's unfair to me. I should be treated first. Granted that because of these things we know, some people will treat the way our economy is, the way the society is now. He gets up, he jumps and runs away. Otherwise, doctors know. We know that my life of my patient shall be my first consideration. That's the Hippocratic oath. That is the ethics with which we are working. They should have right to reasonable visitation in accordance with prevailing rules and regulations. You admit a patient, his relative should be able to come. In some places, they say, no, you don't have to. You cannot. No. Tell them the time to come. Tell them the time not to come. It should be written and pasted. Your certificate as a doctor should be behind you in the clinic. As the person is coming, he's seeing your qualifications. and the certification by the different regulation bodies governing your profession. Yeah, it should be behind you, very conspicuous enough that patient will see before even assessing the services in the first place.
This one you just spoke now about visitation and stuff like that. I remember there was a case where a woman that had accident had been in the hospital for weeks. I had a relation that was very close to her, almost the same ward. And the doctors there kept, the nurses, I heard from her that she wasn't responding to treatment until one of her children that was living very far now decided to visit. The moment the lady saw the daughter, gradually she started coming. So now, allowing relatives, friends to visit the patient in the hospital can equally be therapeutic in order to...
It does happen.
It does happen.
It does happen. It does happen. There are people
sometimes it's not just the medical services that the doctors and the nurses render, but...
Yes, it depends on what made the person to even become sick in the first place. Emotional situations, psychological situations cause people to go down. And when you notice psychological, emotional, sometimes there's somebody, let me add to this, the story you've narrated. Somebody was rejected by his boyfriend. All of a sudden, we don't know what happened, he's slumped into coma. And they rushed him in hospital, we checked sugar level, was all right, we checked this, everything was all right. And the moment people who knew what happened, because doctors, we never got the information, where I was working before joining government, the moment the boyfriend appeared, the girl woke up. And we started questioning the boy, what happened? Since this girl woke up before, now that you came, tell us this story. And he began narrate that he said he's not interested in the relationship again. Before you know it. So we see such things occasionally. So we allow some visitation. The only thing is that there are certain things some people will not be able to stand. Otherwise, if you insist you want to be in the
what if the patient insists on seeing a particular person and then the doctors now say, okay, fine, since this is our right, we're talking about the bill right of the right of bill of patient now. If a patient insists that I want to see a child or a spouse, will the doctors send message to the family members that this person needs this person in order to, probably maybe have the treatment?
The visitation we are talking about here is the right to visit somebody. If the patient is well-oriented and says he doesn't need so and so person, we will not allow you. Such situations also come.
Okay.
If they say, I don't need this person, I don't need this person, I don't need this person, then once you say, and by the time you get to see patient, you pass through reception and things like that. Yeah. And if your name is is in the list of people he doesn't want to see, we won't allow you. We won't allow you. Then if you're also in a critical situation where you need a lot of oxygen, you need fresh air, you don't need congested environment and things like that, we will carefully and quietly tell those who are coming, you are not stable that enough to receive visitors. We'll tell them. But as for patients having right of people coming to see them, they have that right of his relatives, because it's even part of the treatment. There are relatives that when they see, this person have come, thank God. Some of them might even those who will help procure some of the drugs you will need. Some of them may even be part of those effecting some part of treatment and paying on deposits and so on and so forth. So they should have that right. So these are the things. Then they should also have right to decline care. I don't not want to take this treatment anymore. Stop, I want to go. You leave them. Yes, subject to prevailing laws and upon full disclosure of the consequences of such a decision. Doctors should be able to tell the patient, if you decline, this will happen, this will happen, this will happen, this declining you are giving now is not in your own interest. It will boomerang on you. This will happen, this will happen. If they insist.
Would that be documented?
No, when a doctor is doing this, he knows he has to document.
Okay.
The moment you begin to resist, no, I don't want to take this anymore. It happens a lot because as you are treating them, particularly now that the economy has become very bad, as you are treating them, the moment they begin to feel they are getting better, they start thinking of the bill. Even without you producing that bill and talking about it, they start thinking. In a private setting, a public, they start thinking of the bill. Now, it's better I go now. The more I stay here, the more money I accumulate. And you, the health worker, you know it is not yet time for this person to go. You still need to, because some medications have what we call dosage. Some antibiotics you need to give it for 1 week. Some drugs you need to give it and monitor response. And you are not satisfied that this patient is fit enough to go home. And he keeps insisting I must go. What you do as a doctor is you go and document it. That this patient wants to go against medical advice. Sometimes you give them to sign. They sign it, then you leave them to go. Yes, yes.
I don't think I concur with that. This one you're saying, because
you are not police.
Your hypocritical law is to save life, first.
But he's saying he has the right to decline. He has the right to say stop. That's part of the education we have come to do today. They have the right to say stop. I do not want to continue. In fact, about 19 years ago, as a house officer in the teaching hospital in Navy, we have this chief executive, a lady who delivered a twin, chief executive of a bank. But she delivered a twin somewhere in a private hospital. Those twins were having problems, newborns, and they were brought into the special care unit when I was a house officer. House officer is a list of the doctors in our cadre. You know, the ones coming fresh from the classroom.
Yeah.
Yes. And my consultant told, we are going to admit. And we admitted. The woman accepted. We treated for 2 days. That treatment should last for a minimum of 10 days. That treatment, ideally, the standard is it should last for minimum 10 days or 10 to 14. In the book, it is 10 to 14. So minimum is what?
10 days.
And after the second day, the woman said, no, I want to go. And I was sent as the youngest of the doctors in that unit then to go and have a chat with the woman. I found out that the problem was, babies stay in a very well-prepared, very comfortable place for those newborns. But then where the mothers stay is congested. They could be up to 15 in one room. Wow. Where the mothers stay. For such babies that are having problems, they don't stay with the mother. We separate them. Yeah. They are in the place we call isolation and incubation and so on. So they only come in from there. When you come in, you remove your shoes and go and breastfeed and come out. And retire to that 2 rooms where you could be up to 20 using 2 rooms. Those 20 using 2 rooms are the same 20 using 1 bedroom, 1 toilet. And this is the chief executive of a bank.
She's not used to such living condition.
So I related the story to my consultant. He said, there's nothing we can do. The woman wants to go. How will I let her go? The only thing is that we'll give her consent to sign. And then I was told again to go and explain the implications. I went and took my time to explain. You have the chances of losing these babies when you go. Do you know? Forget that we gave treatment for 2 days and everything appeared normal. This treatment should last for 10 days. And now you want to truncate it. Please, I understand that place is not that comfortable for you, but that is a sacrifice you will have to bear.
For your children.
This is Nigeria. There's nothing we can do. The spaces are not even there. The money is not even there. This is what the teaching hospital can offer. You just have to take it and make the necessary sacrifices for your twins. Twin babies. She said, no way. There's no way she will stay here for the next 1 day.
Wow.
And we gave her what we call DAMA, discharge against medical advice. And she signed, took those doses away. After 2 days, 1 died. And he ran back with 1. My consultant said, no way, you've signed. I will not continue this treatment because we've messed it up. And she went with that remaining 1. We don't know her fate up till now. So what led me into this is that they have the right to decline treatment.
But I was thinking the medical field was more like protecting. But
no. We don't have the police. There are situations of public interest when what I am suffering is dangerous to you, dangerous to this other person, dangerous to the community, dangerous to the environment. My illness, maybe I can transmit it through my nose. And if it gets another person, we'll start recording deaths in cases of Ebola, coronaviruses, TB, and so on. In that situation, if you say you're declining, we'll tell you no. Because the illness is endangering the lives of the public. Even though you are the one suffering it now, we'll cage you. And that is where isolation, quarantine comes in. If you say no, we'll get law enforcement agents to keep you there. Because that situation is dangerous to the health of many other people. But if it is confined to you and you say no, who knows now, death is there now. Maybe you want to die and go to heaven quickly. We'll leave you.
Now, in the case of some religious bodies don't permit or allow their congregants for blood transfusion. Yes. And then someone is critical and then you guys know that this person needs immediate transfusion. Now, medical practice and sometimes religious beliefs do have clashes.
Yeah, they do.
How do you navigate this area? Are you trying to tell the person that God is bigger than, the medical practitioner is bigger than the God that they serve, or how do you try to, get
yes. Number one is there's a balance. You tell the person first the implication. It is usually with blood transfusion. It's usually with blood transfusion and some surgical procedures. For some illnesses like cancer of the prostate, doctors need to remove the testicles, what we call polamo, right?
Yeah.
Doctors will have to remove it to give that patient, cured or have his life extended for some good length of time. If they decline at that point, there's not much you can do about it. You allow them. But for cases of something like blood, they will decline because of traditional, religious, and things like that. I'm a titled man like me. What do you mean? You want to remove my testes and why am I a man? You leave such a person, there's not much you can do. But you must document or get him to sign. If you want him to sign, he doesn't want to sign. You still don't have to force him, you must sign. And you put a gun here, you must sign. No. You go to the patient's record and document. This man refused orchidectomy, and you put your signature and put everything that happened. But in case of people who are refusing something like blood transfusion, the Jehovah's Witnesses, people who don't believe in that, it depends. So if the patient who is to benefit from that blood transfusion is a minor, below 18, it's a minor, you insist.
As against the parents?
Use of the parents. And you shout and find a way of sending that patient away. Say, no, this man, that's one of the things we call Child Right Act.
And it extends to the medical...
It extends to, that child has the right to live. The person, government is also responsible for that child, not only you. Yes, you are the father, you are the mother. But in this situation, no, we won't allow you to kill the child. This child should have blood. And you are saying no. Because you are the mother. No, your right does not cross in that situation. Usually doctors shout in such situations and intimidate such persons and send them away, explain their right, and get blood and transfuse that child. Yes. They will even allow you to take the child away. Yes. But if you are an adult, old enough, and you say you don't, well, we'll leave you. We'll give you that you sign. Discharge against medical advice. Or we'll document that we offered you this and you refuse. So when you die, people won't come and start making noise. Well,
let's take a break there and go for a street walk. When we come back, you'll definitely be reading out some of this Bill of Rights of Nigerian patients so that we definitely get to know our rights and the limits, the jurisdiction, so that we can definitely hold certain doctors and nurses, health workers accountable when things don't go our way. Don't go anywhere. We'll be right back.
Kwesị ka enwe free medical services. Ọ dị possible ekwesị na-eje n'ụlọ na-ajụ anyị kedu ife anyị na-eri. A na-echeki environment anyị ka ọ dị. Anyị nwa bụ ndị ụka. Ebe a na-akpọ bụ environmental theology. Environment gị ga-determine ka arụ ike gị ga-esi dị. So onye amara akụzieli ya. So ekwesịrị ka a na-akụzili anyị ka anyị ga-esi na-ebi. Ife anyị na-eri, mmiri anyị na-aṅụ, maka na anyị gụghalịrị nne anyị malụ na mmiri dị na water bottle or na plastic can anwụcha anya na ọ na-ebute cancer ọ ebe a kụziere anyị ejisi anyị na 1 gram purity of water is 1 gram per cm cube so ife ndị a bụ ife na-egbusisi mmadụ ịnọkọta na mmadụ erolu daa so ọ dị mkpa mmadụ adị ama ife niile ịghọtago so ọ dị mkpa rinne ka gọọmenti na-ebi anya ọ bụrụ sọsọ a na-ebugheri ego.
We have rights to some drugs that are supposed to be free. The government should provide facilities in the hospital for appropriate medication. Then we also have right to free medical checkups on our health.
Basically, in Nigeria, many people don't know their rights. The cost of going for litigation will be more than the benefit that will come out of it. That's why at times people will go. Even the enlightened one, they will just forget about it. But if it is a place where things work seamlessly, nobody will play with anybody's life. Some may be allergic to some drugs. That's why you're asking. Even I've observed, in the other client, even when your wife is in theater, you will see what is happening. There's a glass, transparent glass. You will be in the other, they will give you a good seat, you will be seeing what they are doing. But here nobody talks about it. So we have right to know the drug they are prescribing for us and how it will work in our body.
As a human being, we have many rights, and as a patient, the government needs or is meant to provide some amenities for us. But in the hospital aspect, we need to have the right to some particular medications in the hospital. So, our country is really hard, and some citizens, they don't have the funds to purchase some drugs for their health, and nobody is accountable for their health. Sometimes some things can hit you, though we have the right, is our responsibility to take care of ourselves, but sometimes there are some sicknesses that hit us. But there are some people that don't have the funds to pay for that, which the government needs to cover for them. Other places, they do that, but here is really hard for them. So government actually needs to cut out the amount that some citizens need to pay when it comes to their health.
You're still back, and the doctor is very much in the studio here trying to tell us the patient's bill of rights, knowing your rights as a patient in Nigeria. Well, before we went for that short break, there was one case I wanted to bring out about the impatience of nurses when it has to do with patients. But I want the doctor to finish reading out this bill so that we get to know where we stand on that issue. Please, Dr. Go.
Thank you very much. The remaining ones are the right to decline or consent to participate in medical research, experimental procedures, or clinical trials. Doctors and pharmacists, we derive drugs every day for this and for that. And before you say this is good for the public, they undergo trials. And sometimes these trials are done in human subjects. So they must give you consent before you use them for experiments. Yes, if they don't give you, you don't continue. You don't force them. Even questions about certain medical situations around, if they say they are not giving the information, you don't force anybody to give you information. It's their right to say, no, I don't want to. Even when they began participating at a point, they say, no, I don't want to continue. You allow them. You allow them to discontinue. It's their right. They should have right to quality care in accordance to prevailing standards. They should have the right to complain and express dissatisfaction regarding services received. Yes. You go to a teaching hospital, general hospital, they finish treating you. Maybe you are wise enough and you discover that these services are not so good. But the most important thing is to have my health. When you have your health, return to the head of that facility. This was done, this was done, this was done, I wasn't satisfied. It's your right to put up such complaints so that the healthcare system can be improved upon. In some places, they put a box, express your feeling before you go. You write it and put inside. I've seen it in some hospitals. Not only in hospitals, in some hotels. Such public places, there must be a way of expressing.
As in getting the feelers from the public.
Yes.
On their services.
On their services. Whether good or bad. So you could also commend those who have done well. This particular nurse was so good to me. Please make sure she doesn't leave this place. In my years of practice, somebody have come telling me this. You see this nurse that has been working with you people. Hi, make sure she's comfortable here. Don't allow her go. Yes. Where I was working before joining government in one mission hospital. At a point, they heard I was having problems with the management of the place. And the community came, because it's a community hospital. They came, and behind me, I didn't know. They went to the people managing the place and said, if this doctor leaves, we'll set this place ablaze. Yes, there should be a way. Because they were seeing certain things, they were seeing I wasn't happy, I was always complaining, this and some of them, they gathered themselves under the umbrella of the town union and went to management and said, if this one leaves, we'll set this place ablaze. They didn't set the place ablaze eventually anyway, but that's to tell you, there must be a way of getting a feedback
from
some people. Yes. So that's the end of it.
Now talking about health workers and the Bill of Rights of Nigerian Patients, there are some hospitals you go to. Everybody is wearing white, the nurses, doctors, and everything. But you as a patient, you begin to feel the torment of some of these health workers, especially the nurses. These are people that are meant to comfort you to wellness, even though you're sick. But the kind of treatment you get from these people is not encouraging. You complain sometimes to the management, nothing happens. You complain to even people that recommended you to such facilities, and nothing happens. So in this case, who do we complain to when we have things like that, so that as patients, our rights too wouldn't be infringed upon by people that are, would I say, quacks, or probably having their issues at home and bringing it to workplace?
Well, the most important thing here is that you said in the course of giving the treatment, then some of the rights are infringed upon. Yeah. And some of the needed services are not provided.
The care are not...
The care is not there, the concern is not there. There's what we call empathy. You know, imagining the patient being you. Imagining you being the patient, sorry. And you don't notice these things. Well, you said it all completely, because the right channel, the right way to present such complaint is the management of the place.
Okay.
Usually it is not the nurse that heads the health facility. He works under a doctor. Get to that doctor and complain. If it is not solved, it is not attended to, then Anambra State have what we call Anambra State Health Facility Accreditation and Monitoring Unit. I will have their numbers. I will have to state them here. The present commissioner, who actually started this patient bill of rights, we weren't the one that started it. He read and saw it somewhere, and began saying, no, this is something we must cascade down. And to people like us working under him, we have to find the bill. We have to find it and begin educating the healthcare workers, the patient community. We did it. And today we are here again. It's part of the education. Very soon, jingles will be out on this. It will be played here and in some other radio stations across the state. We are preparing the jingles now on this as a way of educating people. So part of it is what you have even raised. Put the right channel of complaints. There must be somebody who is managing the place, or people, or board managing the place. And if it is not satisfactorily attended to, then we have numbers here, what we call Anambra State Health Facility Accreditation and Monitoring Unit. Can I mention those numbers?
Well, the numbers will come at the end of the program.
Yes, these are numbers you can call.
Yeah. One again, we in medical terms, we know of misdiagnosis. That's probably from the health, the lab scientist. I've had a friend told me some time ago, I met him in a facility where I went for my children's, I think malaria treatment or so. So the guy was looking so down and everything. And he said that the result of the test he ran was not speaking too well, that he had to go to another facility to run another test. And it was in total contrast. You understand? So I had finished my own case, but I was interested in what was happening there because he was waiting to see the chief consultant to know why would such a mistake occur. And instead for 2 days, he has been, he's been traumatized, thinking that, so my life is going to be cut short based on this, the outcome of this. In cases like this, what do patients do when you're misdiagnosed? Because already he has started taking medication for something that he's not even suffering from.
Yeah. Yeah, it happens. So, first of all, let us remember, let us not forget that doctors have limitations. We have limitations. Sometimes some diagnosis is difficult to reach. That diagnosis is getting to the root. This is the problem. For instance, I'm having abdominal pain, and somebody continues to treat me for peptic ulcer disease, when actually the problem is acute appendicitis. Let me use that very simple explanation. It's possible that a qualified doctor will miss that diagnosis.
Will miss?
Yes, will not get it. I'm using that simple example.
Is there not meant to be tests to run to ascertain what?
No. That is why sometimes it's good that I use that one as a simple example, ulcer and peptic and appendicitis. Usually those two are easier, very easy to diagnose, very easy. But for cases you see like in teaching hospitals, come on, there are diagnoses that are difficult to make, that will require days. And usually our training as doctors requires that you take your time and take a history. I mean asking questions, we call it clacking patients. You examine, you arrive at something that will aid you to commence treatment while you continue other investigations like lab tests, x-ray, ultrasound, depending on how the patient presented. Now, these things I said now, in some medical illnesses, will require up to a week or even more to reach, particularly when it has become a chronic condition. They come with multiple features. It gives a problem in diagnosis, frankly speaking. And then, but a doctor will have to start something. You can't just be waiting and say, let the lab result come out. There are some lab results, for instance, culture, that will take more than 48 hours for the result to come out. And then, as a doctor, you are not expected to keep waiting
while the patient
is deteriorating, and you keep waiting for lab results. That's the difference in our training. That after taking history and after taking physical examination, you should be able to arrive at something based on which you commence treatment. Sometimes you don't even make the diagnosis, patient recovers. Sometimes you don't even reach that diagnosis and patient becomes all right. For instance, there's what we call extrapulmonary tuberculosis, TB. TB happening other than the respiratory system. TB in the lungs. The usual place you find tuberculosis in the lungs. But you can have TB in the brain. You can have TB in the spine. You can have TB in other parts of the body. By the time you start thinking of this TB, you've given a lot of wrong treatments. It happens because it is not very common. Like malaria, pneumonia, and those ones that are very common. It's not very common. It will take a lot of time. Somebody will have a high index of suspicion and come and say, can we think of TB? At which time treatment for other things have even commenced. And maybe the patient is not responding as expected. Now, causing some other experienced and more qualified doctor to say, no. Instead of this, why not to think of extrapulmonary TB? And when you check the time, from the time patient came to the time people are thinking of this TB, 1 week is gone. It happens. Frankly, it happens. Particularly in an environment where the gadgets are not there. We use more of our brain and the little investigations we can do around.
No,
frankly speaking. Such things, it does happen. So that is why it is always good. Don't wait until you are wheeled
to the
yes, into a facility. Or you are carried and people are shouting and you are now in coma. No, you don't have to wait for such a time. Walk in with your legs and give health workers time to diagnose. Sometimes people are also impatient. An average Anambra person doesn't want to waste time in health facility. He wants it fast. There was a phone call I got some few days ago from my clan, Omonna, from Omonnan. So this woman is having protrusion of the eyeball. Something is pushing the eyeball out. So they called me over the phone. I didn't see the woman, but they called me because they know I'm a doctor. They said, hey, where are you? My mother is. I said, look, your eyeball coming out, both of them or one? They say one, only one is coming out. And the one is not seen again. He's only managing the other one. Oh. I said, okay, this is the kind of case you take to a teaching hospital. Please go to a teaching hospital. Let me use phone calls
to make your
movement easier.
Easy.
And I got somebody who assisted them in teaching hospital. Bam, 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 bam. Usually somebody will see them, tell them this test will be done, this and this and this and that, give them some medications, and ask the woman to remain in the emergency while these tests are done. After 2 days, they say, we don't seem to be getting any result here. The people are not attending to us as expected. What is happening? And they left. Now, they even tell me again that they were leaving. They left. After 1 week, they started again. Is there not a doctor you would recommend his private clinic for us to go? We didn't get anything from teaching hospital. I said, did you leave? That was my response. Did you leave? And they said, they were so lackadaisical with what they were doing, and we left. I said, no. That thing requires a specialized care. So, at which time other symptoms had begun. All this while I didn't see the patient. But it's related to me. And they began saying so many other things. The BP is worsening, the diabetes is worsening. Is there not a private doctor you would recommend? I said, no. This time around, you have to go to Guinness Eye Center in Onitsha. And when you go, please don't go. Don't go. Stay there and give them time. Some diagnoses take time. Some treatment takes time. By the time you start seeing the effect of the treatment, it might take some time, but you need patience. Please go. And they left. After 2 weeks, they called me and began to thank me for taking time, because they even had to leave from there to go do an investigation somewhere in Enugu and came back. I never had the time to go and find out what the problem was because I was busy in office here. But now that woman is leaving.
Wow.
Because they had time. They waited. But an average person in Anambra here, we are known for that. Those of us that travel outside to represent the state in one function at Abuja, they know us that we don't have that time. An Anambra person doesn't want to waste time. Take the money and give me the result now. That's what I want.
And that doesn't work well with sickness.
It doesn't always work with sickness. It doesn't always. Sometimes it requires time. And we are health workers where you don't come on time. So it becomes a certainty.
Well, time is not what we have here. Honestly speaking, I would have loved to continue with this. I'm sure you out there watching us and listening to what Dr. Afam is really saying about the public health rights of patients in Nigeria. We can't extend all time to talk about this. Well, some other time we definitely will be talking about this, but good enough you said that this advert jingles will definitely be coming so that Nigerians, you and I, will definitely get to know more about our rights as it pertains to seeking proper medical attention in hospitals. Well, I want to use this opportunity to thank you, Dr. Afam Anime, for the Director of Public Health, Ministry of Health, Anambra State, for availing us the opportunity to come and tell us and educate us on this thing. Thank you so much.
Thank you very much. Thank you for giving me this opportunity.
You're welcome. And to you out there, we want to say thank you. Because of you, we are here. And definitely, tomorrow we'll definitely get to do it again. My name is Ajulu Chukwu Okabwe. Have a blessed Tuesday. God bless us all.